Hello, welcome to Two Traffic Ninja, a podcast where various dental issues are discussed by Dr. Temitayo, a consultant restorative dentist, to increase the level of oral health awareness in Nigeria. Here is your host, Dr. Temitayo. Hello, everybody. This is Two Traffic Ninja podcast. I'm your host, Dr. Temitayo. Today I'll be talking about mobile dental care. I had a discussion on this with a colleague on Instagram Live about a week ago. So I just thought about why not bring it on my podcast. I'm sure there'll be so many people out there that love to listen to podcasts just like me. I feel listening to podcasts is easier than watching the video and listening to it as well. Many of us have busy schedules. We have house chores to do, we have children, we have so many things to do, and just putting in your headphone and listen to a podcast, it's far easier than watching a video and listening to it as well. I'm sure some of us will agree with me. So let's talk about mobile dental care. Mobile dental care is about bringing oral care to your doorstep. Unlike the regular practice of dental care in a facility or a dental clinic, dental care services can be brought to your homes, to the schools, to your community, so like that. So we know that the population of Nigeria, the people of Nigeria, is increasing every day, and even the life expectancy is actually increasing as well. And there is a lot of variation in our country, Nigeria. One of it is geographical location, which is an important factor when it comes to assessing oral care. The average number of dentists to Nigerian populace is a ratio of 1 to about 47,000. You can see that the numbers of dentists available in Nigeria is quite low. And with this in our mind, obviously, access to oral care is going to be poor, and the level of oral health awareness, of course, too, will be low. So I just thought about it. With this limited number of dentists, how can we bring about equitable and optimal oral health services in our country? I just think about this regularly and almost every time. What can we do to improve the access to oral care in our country? Although the number of dentists in Nigeria is quite low compared to the population, access to oral care will obviously be low, like I said earlier. So I thought about it. Why can't we start doing something like mobile dental care? Why don't you start promoting mobile oral service in our country, Nigeria? I believe one of the means of increasing oral access to people, especially people from the rural environment, is by practicing mobile dental services. Evidence have shown it out there. People that practice this in India, there is of course improved oral care and improved oral care services given to people. Who can benefit from this? I believe we can all benefit from this. Both people in the rural and urban area, old and young, we can all benefit from mobile dental care one way or the other. And so I would say the aim of mobile dental care is to bring dental care to underserved area and underserved people. Underserved area, like the rural area. So many people have. You can imagine, we complain about people not being informed about oral care in the urban region. You can imagine what is going on in the rural area. So this is something we should take very seriously. It's a serious issue. And the underserved people, like the old people, like people in the old people's home, people that are bedridden, you can take dental care to their homes, to their doorstep. Mobile dental services can also operate in schools, especially schools of the needy. Mobile care can also operate in the urban region, especially people with very busy schedule. In my practice, I've met so many people that come to the clinic with serious pain, with serious swelling just from dental caries, and I ask, why are you just coming now? The excuse they give is, I usually have a very busy schedule, very tight schedule. I keep postponing and blah blah blah. I just tell them, I just look at everything and I thought about it. If these people had come very early when they noticed the hole on the tooth, something minimal would have been done to this tooth. So it's important to save our teeth or a tooth as much as possible. So I thought about even mobile dental services can be given to this set of people in the urban region. So almost everybody can enjoy mobile dental service. And again, then thinking about COVID-19, the talk now, and we are being advised to stay at home and limit our going out. This will help limit our exposure to COVID-19. As an individual, you can just call on a mobile dental service, any dentist that own a mobile dental service, to come to your home and give you the basic dental care you need, the basic dental care your family need. So every single person can enjoy mobile dental care. Let's talk about rural area, which is the main reason why mobile dental services actually exist. It actually started in Canada. So I want to believe the success of mobile or portable dental service to a rural area will depend largely on collaborative efforts. An individual cannot do this alone. So it has to be like a collaborative effort from, example, professional dental associations, non-governmental organizations, government sector, local civil society. So this can actually start from the level of a community, and HOBA can just come up with this initiative with other dental or healthcare facility around the community. You can start something like this, especially in the rural area. Just an individual cannot do this in a big community. So a collaborative effort will actually have to come into play. Mobile dental service has its own advantages and it has disadvantages. Of course, the advantages of mobile dental care overrides its disadvantage. Advantages such as mobile dental care increasing access to oral care. Obviously, it will also help improve oral health awareness in Nigeria. Emergency dental treatment can be given to people in this rural area, to the people that need them, the people that doesn't have access to proper oral health facility. Preventive care can be given to people. Screening of oral disease can be done at this level. So, for example, screening for oral cancer, it starts a little before it just gets blown out like that. So, screening for it is another advantage of mobile dental care. Reduction of cost on the patient side. There won't be any need to travel to one dental facility from a rural area to the urban area. Obviously, the cost of treatment is going to be lesser when mobile dentistry is taken to you than you coming to a dental facility. Obviously, when you take mobile dentistry to the school level, primary school level, you catch them young. These children will be exposed to preventive oral care. They will be conscious of their oral care as they are growing old. So all these things are some of the advantages that we can benefit from mobile dental care service. Teledentistry can also be incorporated into mobile dental care service. This I will talk about in another episode. Okay, so the major disadvantage is the fact that every mobile dental unit needs electricity, and when you get to rural areas in our country, Nigeria, electricity is quite a problem. So there is no mobile dental clinic that wouldn't need you to make use of it of an electricity. Another thing is the fact that not all dental procedures can be done via this mode of dental service, but the basic one can be done, and the right to referral can be given to patient that needs referral. So you can't just say, okay, I'm doing mobile dentistry and I want to do an oral surgery on a patient. That might not be possible. But the basic oral care need can be given to people. Basic emergency treatments can be given to people via mobile dental care. Let me conclude by saying that mobile dental care service, like I said earlier, is an effective and efficient way to take dental service to the doorstep of underserved area and underserved individuals. School premises, old people's home, business facilities, people with very busy schedule and all that. Rural area, like I stated earlier. And for this to work, it's going to be based on collaborative efforts. Not an individual can do this, but as an individual, you can start your own little bit. Most mobile dental services are owned by private owners in Nigeria, and most of them, of course, live in the urban area. You can start your own little bit. I know most dentists will not be interested in going to rural areas, but I'm sure a lot of people, quite a number of dentists will be interested in going all the way to helping people in the rural area. I have a lot of people around me that are really, really interested in that. So, like I said, it's a collaborative effort to make mobile dental services easier in Nigeria. But as an individual, you can start something. And as the people of Nigeria, it's important for us to know that there's something called mobile dental service, and we can, of course, enjoy the service. And people are there to give it to you. Dentists are there to provide the services for you. So if you have any need for mobile dental care, you can contact me via my page on Instagram at ToothTrafficNiger. So I want to say thank you to my beautiful listeners. I want to thank you for tuning in today, for listening to this podcast. You are like my support in terms of creating this little audio messages to help increase the level of oral health awareness in Nigeria. You can follow at ToothTrafficNiger on Instagram. You can send in your questions, any clarification, send in messages, and of course I'll be able to read them via this means. Yes, I'm Dr. Temitayo, your host at ToothTrafficNiger. ToothTrafficNiger is about increasing the level of oral health awareness in Nigeria. I can't do this alone, but I'm just trying to put this out there to do my own little bit. Thank you for tuning in once again. Bye for now.